All right, let's just cut right to it. There's a question that's probably been nagging at the back of your mind, and it is deeply unsettling for millions of us. Is the entire idea of retirement, the one we were promised, is it just disappearing? You know the deal. For decades, the promise was clear. You work hard, you follow the rules, and you earn your golden years. You earn your rest. But folks, that promise, it's breaking.
Look, in this explainer, I'm just going to tell it like it is. The old foundation, the old certainties, they're collapsing. And pretending they're not is probably the single most dangerous financial decision you could make right now. We're going to look at the cold, hard numbers, the very real human cost, and yeah, we're also going to talk about what we can actually do about it.
So first things first, to really get a handle on the crisis we're in today, we have to understand what we've lost. The whole foundation of retirement security has been radically transformed, and honestly, almost no one was ready for the earthquake. Okay, now what's so fascinating here is the contrast. You see, the old model was what they called the three-legged stool. You had Social Security, whatever you could save yourself, and here's the kicker, a company pension. That third leg was the bedrock. It meant you had a stable, predictable income. Well, in our new reality, that bedrock has been dynamited out from under most people. All the risk, all the crazy market swings, the whole burden, it's been shifted squarely onto your shoulders.
And let's be brutally honest about the difference here, because it is everything. A defined benefit plan, a pension, that was a promise. It was a promise from your employer for a certain amount of money every month for the rest of your life. A defined contribution plan, like a 401k, that's just a savings account. It's an account that you have to manage, you have to grow, and you have to bear all of the risk. One was a guarantee, the other is a gamble. And our entire society has been moved from the guarantee to the gamble.
And this massive shift, well, it's created what you can only really call a perfect storm of financial insecurity. This wasn't some tiny little tweak to the system. No, it has created an economy that is just incredibly fragile for anyone trying to plan for their later years.
The sources we looked at have this incredibly powerful way of describing it. They call it the Jenga tower economy. Think about it. Your retirement is built piece by piece, right? Your savings, your home equity, your health, but the whole structure is wobbly. And it only takes one bad move, a sudden market crash, an unexpected health crisis, losing a partner to pull out that one wrong block and send the whole entire tower crashing down.
And please, don't think this is just some abstract idea. This is the reality. Get this, 80%. A staggering 80% of older households cannot withstand a single major financial shock. Let that sink in. For 4 out of every 5 households, that Jenga tower is one piece of bad luck away from total collapse.
And if that wasn't bad enough, it doesn't stop there. 45% of older households, we're talking over 19 million families, can't even cover their most basic essential living costs right now. Not vacations, not hobbies. We are talking about food, housing, and medicine. The absolute basics are becoming unaffordable.
So what's one of the biggest blocks in that Jenga tower? Healthcare. The average 65-year-old couple can expect to spend, brace yourself, a stunning $272,000 on medical care during their retirement. Now, be honest, how many of us have that kind of cash just sitting there earmarked only for healthcare?
And this chart really just spells out the squeeze. A lot of people think, oh, it's okay, I'll have Social Security. But take a look at where that money actually goes before you ever see it. Almost 30% of your Social Security check can get eaten up immediately by Medicare premiums, by copays, by all the stuff that isn't even covered. It's a safety net that's full of holes. Okay, so this relentless financial pressure, it creates an absolutely devastating human cost. The numbers are bleak, for sure, but the social and the emotional fallout from this crisis, it's just as bad, if not worse.
There's a term for this in the research. They call it the invisible people crisis. It's this idea that as people get older and they become more financially insecure, they don't just lose their money, they start to lose their connection to society. They lose their meaningful roles. They get pushed to the sidelines. They become disconnected. And basically, they become invisible.
And that invisibility, well, it leads directly to this. Just look at these numbers. North America has the highest rate of loneliness among older adults on the planet, over 30%. In fact, the U.S. Surgeon General has officially declared this a public health epidemic. This isn't just about feeling sad. This is a medical condition that massively increases your risk of dementia, heart disease, and stroke.
So here's the gut punch. What is our biggest collective blind spot in all of this?
According to the John Hancock Longevity Preparedness Index, it's care. We, as a country, scored a 42 out of a possible 100 on being prepared for our care needs. It was the lowest score of any category. We're not ready financially, and we have no real plan for who is going to take care of us when we really need it. Okay, deep breath. After all of that pretty terrible news, this is the only question that really matters. It all feels so overwhelming, right? The system feels broken. The odds feel stacked against you. So what in the world can you possibly do?
Well, the answer isn't some new financial product or another investment scheme. The real answer is a complete mindset shift, a move away from the very isolation that helped create this crisis. The answer is community.
So what does that even look like? Well, here's one example: the Active Retirement Network. Their mission isn't about selling you something. It's about creating a living, breathing, supportive community that helps people find new purpose, build real connections, and explore what's next. It goes right for the root of the problem: our disconnection from each other.
And look, this isn't just some fluffy, feel-good idea. It means real, tangible support. We're talking about toolkits to help you actually navigate this new phase of life, live events and workshops where you can learn and connect, and maybe the most important part, access to a network of other people who get it, who know exactly what you're going through, because they're going through it too.
The vision here is so clear. As the founder, Dan Flora, puts it, it's about building a central hub, a connection point. It's about changing the narrative from "I have to figure all this out alone" to "we are going to figure this out together."
And co-founder Jim DeMocker echoes that perfectly. The goal is to be a beacon. I mean, when the financial world feels dark and the future feels so uncertain, a community can be that light. It can show a path forward that's built on shared strength and real support.
So let's pull all this together and talk about a real path forward. The old retirement model, it's gone. The new reality, it's tough. But that does not mean your next chapter has to be written with fear and isolation. It can be something completely different. Here it is. The path forward is pretty simple. Step 1, acknowledge the hard reality we've just talked about. Pretending that old promise still exists is the biggest mistake you can make. Step 2, you have to consciously and actively reject the isolation that this new system pushes you into. And step 3, you have to take that action. You have to find your people. You have to join a community. The retirement crisis is here. It is real. But the defining story of your next chapter doesn't have to be financial anxiety or loneliness. By rebuilding the very connections that our modern economy has fractured, you can reclaim your purpose and you can reclaim your future. So the real question isn't whether retirement is disappearing. It's what are we, together, going to build in its place?